Welcome to Looking at Lyme, an educational podcast of the Canadian Lyme Disease Foundation, designed to increase awareness, empower listeners with expert knowledge, and explore solutions. I'm Kim Cairns. In this podcast, we talk with Dr. Sarah Keating. As an anatomic pathologist for more than 35 years, Sarah worked on staff at a number of hospitals in Ontario, as well as at Ontario Forensic Pathology Services. She has recently retired, but is passionate about learning as much as possible about tick-borne diseases in order to help improve the access to care for suffering patients. She maintains her affiliation with the University of Toronto as an Associate Professor Emeritus in the Department of Laboratory Medicine and Pathobiology. In addition to her board role at CanLyme, she is also an active member of ILADS, the International Lyme and Associated Diseases Society. Sarah is committed to spreading awareness of the potential causative role of tick-borne diseases in mental illness, promoting education of Canadian healthcare practitioners and policymakers in tick-borne diseases, and promoting the role of tissue diagnosis to increase our understanding of these diseases. Thank you for joining us today, Sarah.
Thank you for having me, Kim.
So, Sarah, I'm curious, how did you become interested in being a pathologist?
When I was a medical student, I did a short elective in pathology, and I found it quite fascinating. At that time, it was an autopsy elective, but most pathologists do not focus most of their time on autopsies, actually. Mostly they're diagnosing biopsies under the microscope or looking at specimens that are removed at surgery. I've always been interested in autopsies as a great way to figure out what happened after the fact.
I can see the appeal of that, finding out what happened, going back in time, really.
Yes, and when I was working at Ontario Forensic Pathology Services, each case was almost like a little detective story. You had to put various bits of information together and figure out what happened.
For listeners who aren't aware, what does being a pathologist entail?
Well, pathology is the study of disease, and it's a medical specialty. It's also sometimes referred to as laboratory medicine. Pathologists have a reputation for not communicating with people a lot, since we don't communicate directly with patients in most cases. But actually, the pathologist does communicate with all the different specialties. For example, at one point, I was specializing in soft tissue tumors and bone tumors, and we would meet once a week, and I would show the pathology, and the clinicians would be there discussing how to manage the case, and the radiologist would be there showing the x-rays. It really is very collaborative nowadays.
What led you to become interested in studying Lyme?
4 years ago, my daughter was diagnosed with Lyme at the age of 33. Unfortunately, she had Lyme and babesiosis. Unfortunately, that very soon resulted in a severe mental health deterioration. She ended up dying by suicide that same year. Unfortunately, too, it was the year the pandemic was declared, so it was very difficult to get treatment for her Lyme. And at that time, we didn't even know that Lyme caused mental illness.
I'm so sorry for your loss.
Thank you.
Such trying times at the start of COVID, just an accumulation of barriers really to you dealing with your grief and the outcome of your daughter's suicide.
That's right. And at the time, when we did realize that Lyme had been the underlying problem, I wanted to find out how I could help other patients. That's what still motivates me.
Absolutely. Yes. How do pathology and Lyme disease research intersect?
CanLyme is in the process of supporting a formalized Canadian biobank for Lyme disease and other tick-borne diseases. Part of biobanks is tissue, storing tissue so that it can be used for research later on. And it's my belief as a pathologist, and is the belief of CanLyme as well, that good pathology is a necessary part of any tissue research that would take place. So, for example, it's important to look at sections of the tissue and see how much of an inflammatory response there is. Where if you're seeing a Lyme disease spirochete, which is the type of bacteria that Lyme is, where is that spirochete?
And do people from across the country, do medical professionals from across the country have access to that lab?
So far is more patient driven. Some patients who are older or ill might say, I want my tissue to be used after I die for research. And those patients would have an opportunity to fill out a form and potentially donate their tissue to the Lyme tissue bank. We can also bank tissue from operations, surgical procedures as well, such as joint replacements.
What kind of access to new information with regard to Lyme are medical professionals apprised of?
Unfortunately, our medical training does not cover Lyme, really. When I graduated from medical school, Lyme was mentioned, and it was known that it was carried by ticks, but there was very little information about how to diagnose or treat it. And that, unfortunately, is still the case today.
You speak to the importance of curiosity with regard to any disease, really, and to keep that curiosity alive rather than landing on a position of, no, it's not possible for it to be long-term, not possible unless there's a bullseye rash. It's important to maintain that curiosity.
Some doctors know that bullseye rash can be indicative of Lyme, but some falsely believe that if there's no rash, there couldn't be Lyme. Some falsely believe that if there was no knowledge of a tick bite, there couldn't be Lyme. There is a tremendous amount of education, not only of the general public, but of the medical professionals as well. And then there is pervasive belief that chronic Lyme doesn't even exist. And that is so damaging to the patients who suffer long-term with an illness that is very akin to long COVID. So hopefully now that there is acknowledgement of long COVID, there'll be more acceptance of other chronic infections such as Lyme and other tick-borne illnesses.
Where was ILADS this year?
This year it was held in San Antonio, Texas.
How was your trip? What did you drop in on? What were the lectures that appealed to you, and what did you learn?
I mean, there was a very good talk on a biobank that they have in California. Liz Horn is the person who heads up that biobank. For me, that was the most helpful since we're just in the process of formalizing our biobank here. We've been in touch with Liz Horn before, and she's very fantastic and very, very helpful and supportive. We can't collaborate with them because of the border. You can't be sending tissues over the border, I think is the problem. My main role in going to ILADS, because I'm not a treating physician, I am a physician, but I'm retired and I didn't treat patients even before I retired. But my role was to meet up with as many of the Canadian healthcare practitioners as I could. Almost everybody who attends the ILADS meeting is a healthcare practitioner who treats Lyme and associated diseases or tick-borne diseases. So my role, one of them was to meet all these people. Some of them had received grants from CanLyme towards their registration fee. So we did meet at lunch one day during the meeting, and everybody was so appreciative to be able to meet each other and talk about common issues that they face, because I think there aren't enough Canadian healthcare practitioners taking care of these patients. And the ones that we have are scattered around the country. And I think sometimes they feel like they're practicing in a vacuum to some extent. There was just a very good energy when we all met, a real interest in having further meetings.
And there's an entry point for new people too. There's an established kind of format for engagement.
I think it's mostly word of mouth for new people. We're always on the lookout for practitioners. Sometimes we engage with patients. They'll make inquiries about what they can do about it, such and such a problem. We'll hear about who they've seen, or we'll be able to tell them who other people have seen. It's more informal. Anybody who's listening to this podcast who hasn't heard from us and who is a healthcare practitioner can certainly get in touch with us through the website.
How does the education grant at CanLyme work for attendance at these conferences?
If healthcare practitioners go to our website, and maybe we can put it in the show notes, since we just had the meeting, we wouldn't be accepting applications for next year's meeting, which is going to be in October 2025, again in San Antonio. There are other opportunities for grants to receive online education. ILADS has a tick-borne basics course that is a very good overview. There are grants available from CanLyme for people to attend that. And I think we can put in the show notes how they access that application.
What was the most helpful thing you took away from the conference?
The talks were excellent. There were up-to-date talks on new methods of diagnosing not only Lyme, but other tick-borne illnesses such as babesiosis. We have a real issue with the two-tiered testing system that we have here in Canada and in the United States being only about 50% sensitive. 50% of the patients who actually have the disease are missed, and then sometimes those patients are told they couldn't have Lyme because their test was negative. But there are other diagnostics that are becoming available. We need to have recognition of those, the validity of those tests in Canada, because so far, sometimes patients are being told, you had testing done in a lab outside of Canada. We don't accept that. We don't know anything about that lab. That has to change. And also we need good, more sensitive testing here in Canada, not only for Lyme, but also for babesiosis.
Are there differences in international standards for diagnosis and treatment of Lyme disease? And if so, what are they?
It's not really something that I can speak to too much because I'm not in the business of diagnosing and treating, but there are differences for sure. I would say that worldwide, though, we've got a problem with diagnosing and treating Lyme and other tick-borne diseases. One of the things that is often forgotten is that currently the diagnosis of Lyme is a clinical diagnosis. And there are checklists that you can use, such as the Horowitz score, that are very useful. You get a score and it'll tell you if you're likely to have Lyme or possibly have Lyme or almost certainly have Lyme. This is something that could be so helpful. Just for example, when a psychiatric patient presents with a new problem, such as my daughter, I think the psychiatric intake should include something like the Horowitz questionnaire, or at least people should be asked, have you ever been bitten by a tick? Have you spent time camping in where there are lots of ticks? Have you ever had a rash, a bullseye rash, or a circular rash? Flu-like illness in the summer, which is not usually when you get the flu, but that's how Lyme can also present.
Kind of curious what role climate change has in the spread of Lyme disease.
It has a huge role because in Canada, our numbers are going up so much. The ticks can be active at 4 degrees Celsius and above. People and dogs are getting bitten in the winter. The ticks can overwinter now, whereas before they might have been killed by frost. The other thing that has sort of made us come in contact more with ticks is the way green spaces are being urbanized. And we're in closer proximity to wildlife such as deer and coyotes and small mammals, mice in our suburbs now than we used to be.
I live in Victoria, so that 4 degrees Celsius is more of a situation here perhaps than in other parts of Canada. I really hear the intersection of urban development and wildlife. Such an increase in the deer population present in our cities. We've taken over their territory, but they're still part of the territory. Is there anything you'd like to add that we haven't talked about?
I'm really excited about all the activities that CanLyme has on the go right now. We've got all this happening with the practitioners that we've talked about. We have the biobank getting started. We are still giving out venture grants for Canadian researchers in tick-borne disease, so they can apply. Their research will be considered for grants. We're going to be doing a lot more advocacy, engaging with policymakers at all levels of government. That's been done in the past as well. Lately, there have been some changes of government, sort of, it hasn't been as good a time to try and do that. We're moving forward with some initiatives to address policymakers. And I think, unfortunately, the more people who are either infected by Lyme disease or have family members who are suffering, the more support and groundswell there is for this initiative.
I wonder if you could talk more about the potential role of tick-borne diseases in mental illness.
There is quite a literature. So after my daughter died, the next year, a paper came out in the American Journal of Psychiatry by Brian Fallon, participated in a large study in Denmark looking at Lyme patients who had been treated in hospital, their subsequent mental health history, and there was an increased rate of all types of mental illness, of depression, suicidal ideation, and increased incidence of suicide in those patients. There are multiple other papers too, but this one was in sort of a mainstream psychiatric journal. It would be expected that it would get more attention. And yet I went to speak to a large psychiatric hospital in Toronto about my daughter's case after she died. And even though she was treated there, they attempted to treat her. There was no recognition then or now that Lyme disease can be a major factor in depression and suicidal behavior. So there is so much work to do in that area. And I'm not saying that this is the only cause ever, but someone who may have genetic predispositions, and then you add to that a chronic infection that tends to go to the central nervous system like Lyme, and then you add to that maybe other stressors such as a worldwide pandemic, toxins. When everything gets put together, then you have a problem, and all the components need to be looked at rather than just treating the symptoms. Is my belief that mostly what psychiatry does right now. I'm not saying you would never want to use psychiatric drugs, because sometimes they're life-saving as well, but there are other things that need to be looked at.
What keeps you going? What keeps you motivated to engage in this discovery of Lyme and all its aspects and spreading that information? What keeps you going at this point?
It is a very fascinating disease, for one thing, but my main motivation is the fact that we weren't able to have this knowledge when my daughter was sick. She had about 10 years of chronic fatigue before we even figured out what was going on. She was a naturopathic doctor herself, and, she would be so happy to know that I'm part of this fight, and her aunt is also on the board of CanLyme. So it's her memory that keeps me going, and the thought that there are other people suffering either the way she did or in different ways with debilitating pain, debilitating chronic fatigue. There's so many different ways it can manifest. These are people that can still be helped, and I want to do everything in my power for as long as I can to help these people in my daughter Leslie's memory.
Thank you. Thank you very much. What would you recommend to people who are recently diagnosed with Lyme?
If people have an acute tick bite, I recommend removing the tick as soon as they see it and saving it. You can put it in a Ziploc bag, or CanLyme has a tick removal kit that has a little container. Put that tick, label it, as to when it was removed, and put it in the freezer. That way, if a bullseye rash appears or any kind of a rash, or you start feeling ill, you can send the tick off to have it tested, or you may just want to do that anyway. It can be tested for pathogens. There is a very good company called Genetics that does this. There is a fee attached, but it is so much cheaper to have that done than to wait and potentially end up with chronic infection. So you can either wait and see if you start feeling ill or if there is a rash. Even if you can't afford to have the tick tested, just be aware of the symptoms. Our website is very good with information for patients. And if there are symptoms, go and seek medical help. Often you have to advocate for yourself. One pill of doxycycline is what's being given out for prevention of Lyme, and we don't have good evidence that that such a small amount of doxycycline will prevent Lyme. And in fact, there is a fear that it might just suppress the rash, and then you'll have a harder time figuring out if you have Lyme at all. 3 weeks of doxycycline is what is recommended by ILADS, at least 3 weeks for treatment of an acute tick bite. But seeking medical help and also educating yourself as much as possible about tick-borne diseases, because unfortunately the patients need to be educated at the moment, as the doctors really aren't. Except for the Lyme literate physicians. We do have many Lyme literate doctors across the country, and naturopaths and nurse practitioners.
Is there anything you'd like to add that I haven't asked you?
The more everybody can talk about Lyme, and if you have questions, get in touch with CanLyme, educate yourself as much as possible. it's important to spread the word that there is a huge problem. And if people are suffering from a chronic illness that's hard to pin down, there is help. You have to seek it out, but the CanLyme website is a good place to start. I think the more people talk about it, the better. And of course, prevention is extremely important. Checking yourself for ticks whenever you come inside from the outdoors, whenever it's above 4 degrees Celsius.
Well, thank you so much for joining us today, Sarah.
You're welcome. Thanks for having me on the podcast.